Endoscopic ultrasound is a special procedure that mixes regular endoscopy with an ultrasound probe. So we use scopes similar to the ones that we use to do a regular endoscopy, but at the tip of the scope, besides having a regular camera, we have a sonogram probe. So we're able to see beyond the stomach or beyond the small bowel, and we can see organs that are usually not reached by regular endoscopy. The people that need this procedure are people who have findings in the pancreas, for example. If they find that you have a cyst or a tumor in the pancreas, traditionally it has been very difficult to reach those organs. With the endoscopic ultrasound, I have the ability to reach those organs in a non-invasive way. With the endoscopic ultrasound, I'm able not only to see those lesions outside of the stomach, but I'm also able to do a biopsy so we can have an accurate diagnosis of what the lesion is. The endoscopic ultrasound has several advantages. The most important thing is that traditionally, when you have a mass in the pancreas, for example, the pancreas is located in a very remote area inside of the abdomen. In order to reach it, you have to pass many organs. So traditionally what people did is that they put needles from outside and they have to go through the stomach, through the colon in order to reach the pancreas. With the endoscopic ultrasound, I'm able to get right next to the pancreas. And with that sonogram probe, I'm able to put a needle right next to the pancreas with a lot of accuracy, and I can reach those lesions that we were not able to reach before, and we're able to get samples that we're not able to get before. There's absolutely no pain involved in this procedure. If we talk a little bit about the way we do it, the patient would come to the endoscopy suite, and their experience would be exactly the same as someone getting a regular endoscopy. So the experience for the patient is that they will come, they will start sleeping, and after a few minutes they will wake up with absolutely no pain, and that would be the experience for the patient. One of the things that you do with this is you stage tumors. So when you're diagnosed with a cancer, you're filming?
Yeah, we're rolling, but try to keep eye contact.
Okay, so another reason you do an endoscopic ultrasound is to stage cancers. So when a doctor diagnoses a cancer, for example, an esophageal cancer or a pancreatic cancer, you need to accurately stage this cancer. And the reason you do that because you want to develop the most appropriate course of treatment for the patient. And it's critical to do an endoscopic ultrasound before you make that decision, because based on those findings during the endoscopic ultrasound, you may want to do chemotherapy, for example, or you may want to go straight for surgery. But in order to make that critical decision, you need an endoscopic ultrasound. Another novel use for the endoscopic ultrasound is to treat pain. There are many patients with pancreatic cancer who have significant pain. And traditionally, one of the ways that we have treated the pain is by doing something called a celiac block. A celiac block is the celiac ganglion is the place where most of the pain fibers in the abdomen go to, and they go through that, and from there they go to the brain. With the endoscopic ultrasound, you have direct access to the celiac ganglion, and I can inject an anesthetic in that area, and by doing that, the patient can achieve significant relief from the pain. The reason you would want to come to Mercy to get this procedure done is because in order to do this procedure, you need the latest technology, and we have that technology available at Mercy Hospital.